TopMedTalk.
Well, hello. It is Anesthesiology 2021. TopMedTalk is here in person, live from the exhibition hall at the annual meeting of the American Association of Anesthesiology in beautiful sunny San Diego, and it feels so good. We are back in person, back in business. I'm Desiree Chappell, and joining me this morning are my co-host, Professor Monty Mythen, our editor-in-chief of TopMedTalk. Monty, good morning.
Great to be here, Desiree.
Great to be here.
Thank you to the ASA.
That is, absolutely. And our colleague, Professor Solomon Aronson.
Thank you. Good to be here. Stay classy, San Diego.
That's right. Well, thank you so much for joining us. To all of our followers who are watching right now, thank you for following us on TopMedTalk and EBPOM. TopMedTalk is the broadcasting arm of EBPOM, or Evidence-Based Perioperative Medicine. And just really quickly, for all of our new listeners, Monty, tell us about EBPOM.
So EBPOM is 25 years old next year. It is complementary to our endeavor as anesthesia providers around the world. It's the extended role of the anesthesia provider, was the beginning of it, to go up from the stool and out before and after the surgical procedure to try and improve outcome from our patients. Now, you could argue that's fully integrated into what we do as anesthesia providers, but 25 years ago, it was a subject of great debate. So that's where we started, and here we are just about to celebrate our 25th anniversary. So I'm kind of guessing that we all agree.
I think it's taken off. But if
we're slow to learn.
That's right. Well, if you want to find more about EBPOM, you can find it at ebpom.org. That's the website for EBPOM. Can you tell us about TopMedTalk very quickly?
So you said EBPOM, 25 years old next year, and a few years ago we realized the fact that we couldn't necessarily, in advance of the global pandemic with COVID, where suddenly virtual meetings became the new norm, we realized there was a massive audience that we weren't reaching. Yeah. So we went into live radio broadcasting the message because it's accessible to the whole world, and then flipped that into podcasting. And 1.5 million plus downloads later, more than 100 countries, that seems to work too. And now here we are with the ASA for about the 5th time, I think.
It is.
In the Trade Exhibition Center, talking to really cool people.
That's right. So without further ado, poor Kraig sitting here.
I was wondering when it was showing up.
Kraig, that's your cue.
So one of the things that we want to do here at ASA is have our fantastic conversations with key opinion leaders, some of the speakers here, leadership with the ASA. And so we are so fortunate to have Dr. Kraig Lanzac from New Orleans, Louisiana. Kraig, thank you so much for joining us.
Thank you for me. I am so excited to be back in person.
Oh my God.
Getting on the plane was just the best thing in the world yesterday. I'm thrilled to be here this morning, so thank you for having me.
Well, absolutely. Well, Kraig, for everyone watching and listening today, tell us just a little bit more about yourself.
Sure. I am the Assistant Secretary of the American Society of Anesthesiologists. I've been in that role for 3 years. I'm hoping to be reelected this year. I'm running unopposed. Always exciting to do that.
Good luck.
Thank you. I practice. I've probably split my career between academic and private practice. I was the former head of a small private practice group. I've spent the other half of my career in academic practice, and now with the Tulane Department of Anesthesiology in New Orleans, Louisiana, where I work with residents. That's my primary push. I'm also the clinical director at one of our smaller facilities at Tulane Lakeside Hospital, mostly orthopedic and women's services.
Fantastic. Well, today we're here to talk about young member engagement, right?
Correct.
And tell us, we all know right now the struggle with the healthcare industry in general. There just aren't enough people, and the people that we have aren't always engaged. So tell us a little bit more about this work that you're doing.
So, when you look just... You don't have to go further than the ASA's mission, which is advancing the practice and securing the future. Mm-hmm. The only way we're going to secure the future is if we get folks, no matter how long us mid-career, I guess I'll consider myself maybe nearing end, how hard and long we want to work, at some point somebody else is going to have to take over the legacy of this field and the legacy of this organization. And I passionately believe as the American Society of Anesthesiologists goes, so does the field of anesthesiology in the United States. So we have to train up, mentor up, engage our young members in any way possible. We're talking from medical students, residents, and the early career members. So to me, I just see it as the lifeblood. I mean, it's cliche to say that children are the future, but our young members are the future of this field. And my hope is to leave the legacy of the specialty that I've loved to them. I also say, and you gentlemen will understand this, we talk about postgraduate year with our young members. I consider myself a PGY 28. And if you're familiar with that salt oath, my residents get a kick out of that. So I'm just a kid at heart.
Well, I'm not going to ask Monty and Sol what PG.
Okay.
No, Monty.
Yeah.
I thought you had a question.
I do, Kraig. So, I've got 4 children. My oldest son is a doctor. He's at what we call in the UK FY3, so the foundation years. He's 3 years into practicing.
Nice.
And, he's thinking, what should I do next? And I'm, I think he should become an anesthesiologist. What do you say to the youngsters at that stage?
So I have a 4th-year college student son who is looking to go to medical school, and I said, let's see how it is when you go in. But I tell them, you'll know when you know. You know, I always feel like some folks are forced into one especially another. To me, I started medical school. I was going to be a pediatrician. There was no doubt, absolutely a pediatrician. Got on anesthesiology rotation by luck, and I was like, oh, this is for me. This is exactly what I wanted to do. So it's having them feel what it is that they want to do and reminding them. You see some get locked up into, my fellowship, my residency is long or this one's short. And I'm like, you're going to spend the next 30 to 40 years doing it. You better like it, whether your fellowship and residency takes 10 years or takes only 4 years. So I really try to do it. But the hardest part for us, I think, is getting the exposure to the medical students. Not every medical school has the luxury of an anesthesiology rotation. Some do. So we really work hard at Tulane to get those kids in. My former time at LSU, the same thing. Get those young men and young women in. Let them see what we do. Let them make the decision. So you got to feel it, and I think we do.
Yeah. Sol?
Well, I'll just sort of, jump on that same theme. I have a son, Ben Aronson. Hi, Ben. Who's a 3rd-year medical student. Very proud dad. But the question to go a layer deeper is, what do you tell a 3rd-year medical student today as opposed to 30 years ago, 35 years ago, what the field of anesthesiology is going to look like 10 years from now? And to sort of give them that sort of twinkle to pursue this, especially that we've owned and felt so passionate about.
I think even our discussion here about EBPOM sort of foresees or foretells the future, that we don't need to just be in this little cubby in the OR. My private practice group was called Anesthesiology and Perioperative Medical Consultants.
There we go.
And we lived that. We wanted to know everyone in the hospital, and we did. We were throughout the hospital, pre, post, several weeks post-op. We called patients. That's what I wanted them to understand, is we can expand this field and make a bigger difference than we do now. It's nice in the OR, but if we're seeing patients out and helping to prehabilitate and get them prepared for surgery, they then see us the entire way through their continuum of operative care. And I preach all the time about name brand anesthesia. If the patient knows not just, I think that guy's an anesthesiologist, but they know that's Kraig, or that's Dr. D, something with a D, I'll take that. It beats anesthesia, or who's that person that just came through? And now that we're all wearing masks, I can't even say who's that mask guy. There's many. So that expansion into the areas that we are very good at, from critical care, every aspect of the hospital, and leadership roles.
Can I come back on that sector? But the important messaging, I think, that in that, Kraig, is if you don't want to do that and you are keen to apply your skills in the traditional sense in the operating room, we need lots of people doing that as well.
Yes.
So it's not it's just expanding the portfolio of careers within the career of being an anesthesia provider.
I couldn't agree further. I think that was one of the draws for me, is I was going to be able to deal with patients from crib to grave and every condition. I always talk about the fact that every patient, to the surgeon maybe we're going to be doing their arm today, but to us they bring their baggage. We're the check baggage folks, and they go, here's all my medical baggage, all my perioperative problems. You sort this out, and I want to see you on the flight inside. And I think that as anesthesiologists we have a role for everyone to take those roles and the others, leadership, wherever they need to be. And I think we have an expansive field and continue to expand. So that's what I tell them. Opportunity is great.
How are we messaging that sort of adaptability of the specialty? I mean, anesthesiology is a field that has been adapted to the times over the years, and we can name many examples. You spoke to critical care, and we're now speaking to the upstream preoperative assessment. How do we message that? How are we getting that to our residents and even upstream?
It's a great question. I think that the nice thing I see is we are engaging younger and younger members. We now have more medical student members in the ASA than we have ever had, over 3,000. We have more resident members. We're approximately 8,000. So we let them sample what it is being a member of the American Society of Anesthesiologists is. I spoke to a young lady last night who has been very involved in the resident component. She told me she matched into surgery. She chose to go a different way, and that's okay. I'd rather see her get exposed to what we do, what anesthesiologists are, what our American Society of Anesthesiologists is, and make the decision. Now, she did tell me she will always make sure she knows the name of the anesthesiologist in the room and not just, hey, anesthesia. So I told her I'd hold her to that. But trying to get them engaged early and to get a feel for what it is that we want to do with this field and what we want them to help us bring. You know, bringing in the younger members gives us strength and vibrancy, and it gives us a new perspective. You know, I always talk about the fact that I can look back and think what is it that I was interested in as a resident probably has no bearing on what those residents want right now. So we've worked very hard at ASA to target we talk about members of our organization, and we think all our members are great, and we're focusing on our retired members now, but we're focusing on the early career members, and they're just not the same. You know, your CA1, your first-year anesthesia resident, looks nothing like that last-year resident. Their first day, one of them's trying to find out where the bathroom is, and the other one's trying to get a job. So we have to target where they are, when they are, give them what they need, when they need it, and hopefully even before they even need it.
Well, Kraig, that brings us to some of the efforts that the ASA is doing, to engage new members. So can you walk us through some of those things?
Absolutely. We've started a new residency engagement department. Nate Wicks is a very talented individual who's heading that. That's only come out in February 2020. And that is a direct focus towards resident members and our medical student members. We're also transitioned to what we're calling early career members, that first 10 years. And one of the things that we've seen is if we can have a member of our American Society of Anesthesiologists for the first 10 years, they're probably going to be career-long members. Those are the folks that we need to help to engage. The nice thing about ASA membership, it is what you put into it, and you can actually make the organization better by being involved. You have a gym membership, you pay your gym membership, you go work out, you're probably not going to put anything back into that gym. You have a membership in the American Society of Anesthesiologists, you can make a direct change in our direction. So we know that we're focusing on that. For our resident members, we're going very explicitly at each level. And when they come out in early career members, just in the past year, we are targeting that transition to active membership and helping them to see what is it they need. They don't need what a mid-career, late-career doctor needs. They need help with getting a career. How do I go? Do I want to be in a practice that's perioperative medicine, or do I want to be just in the OR, in the OB unit? Those are decisions that I think we just kind of felt our way through when I came out. Right now, we're trying to give the resources, and we did it in a smart way. We talked to them. We actually talked.
What do you need?
What is it we can do for you as ASA? And we took that research and we continued. We call it our life cycle and ecosystem research. What do you need right now as a third-year resident? What do you need right now as you're finishing your fellowship? What can we do to provide that? And a lot of the talk goes around mentorship and near-peer mentorship. You know, it's nice we're hearing from our retiring members that they want to be mentors, but apparently the young doctors don't want to hear from us old guys. So we're going to get the near peers. We're still going to use those the senior physicians, but we're going to get the near peers to them.
Walk me through how you do that connectivity. So how do you enable that peer-to-peer mentorship? What is the mechanisms that we use?
So we're very early on with that, but one of the things that we have is we now have better information as residency where they are in their residency. Are they a CA2? Are they in their second year of clinical anesthesia? And who else is in that area in the CA3 and out in the career area? So if we can get a feel for where they are and know where they're going, one of the toughest parts is when they finish, they've got their .edu address from their organization. We want to stay in touch, but now they don't have that address. So making sure that we link with them and they don't want to lose us as much as we don't want to lose them. So what we're trying to do is come up with this network of mentorship. And we have virtual mentorship right now. You know, COVID has done interesting things, but the one thing it has done is taught us to use the technology to the fullest. Our resident website is nothing like it used to be. You can go on and get financial advice, wellness advice. There's some information there I probably should go spend some time with about my finances too. But it is impressive what is there. And then we're developing, based on what they wanted, a curriculum. We're putting up some interesting talks and lectures and using the expertise nationwide. Grand rounds on demand, basically, is something we're going to be looking at too. I've got Monty here. I can have him speak at our place tomorrow about flipping a switch. So we're going to do that because the residents
I'll have to check his schedule.
Check his I'm still working on that schedule. But having that opportunity. So we are early in that, developing that mentorship. But I will tell you, as we hear something, we're putting it. We heard, hey, members may have some difficulty transitioning from residents to first-year actives to first-year active membership. We might have a different price tag of membership. So we're looking now at this meeting. Our governance team will be working on a project to put together a bundle of membership where it's sort of a multi-year. It's not just a lower dues, but a bundle of information. Maybe they get to attend this meeting at a lower price point. Maybe they get some education materials they would have never touched on our website for free to engage them and give them some of the lifelong learning we want them to be involved in.
Kraig, it sounds like the website's sort of the home base. So if a resident's out there trying to figure out how do I get involved, is the website the home landing page, or what would you advise that listener who's interested in connecting
I think that's a great question, because we also know from our research that not all the young folks go to the websites. Websites become kind of cliche. So we have a podcast series as well. We have a Residents in a Room podcast series.
Excellent.
We have a Central Lawn podcast series for our more our active members and senior members. We have active social media. We're also marketing through email, and I hate to use the term marketing, but we're trying to connect, and it is marketing. We through email and through our social media to different levels. So if I know, Sol, you're CA1 and our very senior CA3 over here, I want to send you two different messages so you know and you feel that ASA knows who I am. I'm not just a member.
Very cool.
It is.
So it's targeted.
Yeah, I love
Yes,
that.
very
Some of the things, too, that I've seen, like recognition opportunities. Because, there's different ways to engage people. And one of those is that they, and I think you've said this, people feel part of something.
Correct.
Tell us about that.
And to that last statement, I want people to feel their membership.
Yeah.
You're a resident. They hand you a card that says, well, they don't even hand a card anymore. I'm sorry.
Thank you.
They're emailing you a card.
My first day, I filled out in triplicate the old white, pink, and yellow form, and we mailed it off for ASA and website. I'm sorry.
I'm so old.
Dial up.
I think I completely lost it. But
the recognition opportunities.
Correct. And we're trying to develop this. We already have as active members what we call our fellow of the American Society of Anesthesiologists, and that's a recognition. We're looking now at possibly coming up with something at the resident level, an early career level. And we learned that through another sort of new project, which is our Program Directors Advisory Group. Program directors are the key to the residents and medical students. They're the people that decide if you're coming to our program, how you do in our program, and people look to those program directors. And I realized about a year ago, after all the COVID experience and thinking, God, program directors are really hurting right now, we should really, as ASA, engage the program directors and find out what can we do as ASA to help them and let them, because again, if they are doing well, ASA is doing well, and our field is doing well. If we're not doing well and the field isn't, the program directors are probably struggling. We want the best and brightest. So we engage them, and they have been fantastic with helping us refine offerings. If I put out something and say, Monty, this is for you, your resident, this is great, the program director can tell us, our residents don't care about that. They don't want to be involved. And then we don't have to flop and fail. We get it right back with that immediate input. And that's been fantastic this past year.
Yeah.
Excellent.
Fantastic. Well, tell us a little bit about how you are supporting our young anesthesiologists through COVID, because it's very difficult, but some of them might have been pushed out into this world that doesn't look like anything anybody's seen before. So, what are some of the resources for that?
When you think about those folks that have finished in the past 2 years, and even those that still in their residency now, the difference that they've had in their training as a result. And I'm from New Orleans. We just had a hurricane shut us down for a couple weeks. So layer those common everyday crises on top of this foundational crisis we have now. It's changed these individuals. And what we're trying to do is obviously give them any kind of wellness resources we can, but to make sure the didactics have not changed.
Yeah.
So that was one of the things I was very proud that we did as ASA is we let the residents and medical students have a lot of our educational materials for free. And we use that in the residency programs. And then after that, we tried to say, look, what did we not do? What can we do to help you more? So a lot of the job structure, job searches, career opportunities, we're trying to help with that and pair. We were in an exhibitor hall here. We've got a lot of folks looking for anesthesiologists, and we've got a lot of people looking to be an anesthesiologist. And hopefully we can be the conduit to pair those folks up. But trying to get us, to me, ASA was the home where I went to for my information about COVID. When it started, we had several town halls that were refreshing. We were finally talking to other people. We were locked up in our houses buying our special space masks. But it was nice to hear that we're going to be okay. We've got some brilliant people working on the problems. And I went to ASA all the time and the American Patient Safety Foundation to find out what should we be doing. Because, Professor MacGyver has put together a device to do this. Is this a good idea? Should we do this? And there was a lot of that going on. So just being there and also helping all of us, because this incredible baseline stress we're dealing with has changed all our lives. But this meeting and being here is just, to me, the live meeting is the burnout antidote. We talk a lot about burnout.
Oh, I like that. May I steal that?
You may steal that.
That's my phrase.
But it is. You get here, and the excitement you feel just from walking in this early morning. And I always came away from the meetings, and still do, completely intimidated with what I didn't know and what I need to learn. You feel that, Sol?
PGY 28.
Yeah, 28. And I would sit in the lecture and go, oh my gosh, I should be doing that. And that is so refreshing. And I love that we can share this virtually. And I hope that all of your listeners and viewers can come out to our next meeting in New Orleans.
Yeah,
our next American Society of Anesthesiologists.
I believe that's pronounced Nolans.
Nolans, exactly. We got, like I said, we got a hurricane out the way this year.
I was just going to say next year.
We're going to be good next year. But this to me is, and to a lot of residents and early career members, this meeting is what ASA is.
Yeah.
And what we need to do is take this opportunity and show them all the things that we can do career long. I think we don't do well without ASA, and ASA doesn't do well without anesthesiologists. So.
There you go.
Here.
Well, Kraig, as we wrap here, tell us how, if people are interested, exactly how do they get a hold of all of this information?
Tons of information. Obviously, go to the website.
How do you wrap your arms around that? All that?
The website is asahq.org, American Society of Anesthesiologists, headquarters.org. We're on social media. You've got probably all of our handles everywhere. We're ever present on social media, so you can always click through there. Certainly show up, come up to a meeting anytime. If you've got any specifics, you can always holler at me. My email's all over the website as well.
And I was just going to say, and that email is?
my AS email is
Don't come in here.
I was just going to say.
But it is my first letter of my name, which is K for Kraig. And then Lanzac at asahq.org. And I'm happy to take emails. And honestly, the feedback we get, we are actively using. So that used to be trite to just say, well, call me if there's something you think we can do. No, we're really taking that on. And that's a personal promise from me. If you give us some information, we're going to try to use it best we can.
And you really want it. I mean, that's how you move the needle.
I want it to be FOMO, as the kids say.
That's
Fear of missing out. I want there to be fear of missing out. And wait, ASA said something? Wait, I better get to that. And I just believe that is important for our patients. All of this translates to the patients. The best educated, we want the best and the brightest in the field, and that ultimately protects our patients, which is at the base of all of this.
Yeah, absolutely.
Here.
Well, Kraig, thank you so much for starting the meeting off with us here at TopMedTalk. And of course, we want to thank the American Society of Anesthesiologists for the support to have TopMedTalk here in the exhibit area. It's going to be a wonderful 3 days of conversations just like this. So be sure to check us out throughout Saturday, Sunday, and Monday. Kraig, have a fantastic meeting.
Thank you
so much.
Thank you for having me.
What a pleasure.
It was very nice.
Cheers, everyone.
TopMedTalk. Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.